I'm not one to complain. I find complaining makes the pain worse. When I have severe pain, finding something to work through the pain ends up helping me, because through the process, some of that pain is alleviated, whether it's because my thought process is elsewhere, or whether what I'm doing is actually serving to help the pain.
Yeah, and those were some of the things that Mark and I were talking about, is the different things from, if you're experiencing pain and you know it's going to pass, how can you get through those, that hour or those 5 minutes? Can you distract yourself? Can you, find something else that you're interested in? And the idea we were talking about is what was it, gate something? I'm studying for my exam, so I know just enough information to be dangerous. But the idea that the body can only register so much stimuli at once, and so if gateway, so if you give it a stimuli like a coldness or a massage, that's all it can kind of focus on at that moment. So I'm not a pain specialist psychologist, but there are psychologists out there who specialize in pain and the behavioral interventions to address those things. And I just love the way that you, talked about all these different ways that you use in your life.
And I was I saw another connection here. Something was saying in cognitive therapy, which is the words we use. I mean, in my training in that area, where you'll say, and it's not just about pain, but almost any issue, particularly in relation to bringing in where you cause yourself to have depression. Awfulizing. Oh God, it's really terrible. And then the comeback, the therapist or whoever's with you says, "Is it really? What's the evidence? Is it really awful? Is it just, it's inconvenient? It's bad." The importance of this is the language that you use to yourself is quite impactful for depression, and I think now listening to this, to pain itself, how you get down to really looking at it and being accurate about it. And it's something. It's not my best friend, but I can contain it. I can deal with it.
Something else that can help some people, the gentleman mentioned kidney stones. When I was having problems, my gallstones, I had gone through Lamaze when I had my children, and the breathing. And one of the best breathing tools that I use is the and it's a combination of taking your mind off the pain, but also you're exercising other muscles and you're getting another part of you moving and busy without getting up and moving around. It takes you someplace else. But the 4 he-he-he's and the slow breathing out through your mouth, I've used that a million times. I just think, but you can look at that online too and find out about breathing exercises.
I used to do Lamaze many years ago when I worked in the high school for pregnant students.
Well, try to remember your breathing, because I was on all fours. My duct was full of gallstones, but because one test didn't say I needed surgery, it took a 3rd trip asking to see a different doctor, telling him about the test results, telling him about the test showed my gallbladder was full of stones and the ureter was filled with stones, to do an emergency surgery. Again, I was calm. I was in pain. I was calm, but I was on all fours, literally on the sofa, because the floor was too hard, so I couldn't be on all fours on the floor. And I did my breathing. And on the way to the hospital, I was on the back seat on all fours doing my breathing. And that's what got me there. So if you can remember your Lamaze breathing, might come in handy.
were operated on by the doctor?
Yes.
So that stopped that pain?
Pardon me?
That stopped that pain?
Oh, yeah. Yeah. Oh, amen. I didn't need that on top of everything else. Yes.
I have joint issues, and after 2 surgeries, I was going to a physical therapist, and one of the things that he did was he said he was trying to retrain the nerves that,
Mhm.
that at the surgery incision place and wherever the surgeon touched, I guess, those nerves were hypersensitive, and he was using massage and a laser and a sonar doohickey, and he was trying to retrain the nerves so that those nerves wouldn't be sensitized and other nerves would, so it would calm the
Right.
nerve down. I'm not sure if it worked. I'm not
There
sure
is
if the surgery
something,
works.
I don't want to put more on your plate, on anybody's plate, but there is something that people don't hear enough of called RSD, reflex sympathetic dystrophy. There's a book that you can get written by a gal who happens to be one of the directors of US Pain. It's called No, It's Not in My Head. I can't think of it now. Chronic pain. It's a trip. As a high school student, she injured her pinky. Just injured it, didn't break it, sprained her pinky playing volleyball. Within 3 weeks, she was wheelchair bound, couldn't dress herself, couldn't bathe herself, couldn't use the facilities herself. And what it is that people don't hear enough about, and medication did not help her, when you have an injury, the nerves strike out and they can't always be tamed. Some people, it affects their whole body. Some people have sprained an ankle and it's just their leg that bothers them. But it's a type of pain that's incapacitating. But again, and that's something you can look up, RSD. And there's also complex, I can't even think of the letters. But Paul, our founder, actually has RSD. And it's his whole body, and it's started on some of his organs as well. He's having heart problems. And so a pain disorder doesn't always affect just that area. That's why it's always good to get medical information from a doctor to see where you're going. But that's something I'd never heard about until 2010.
What kind of doctor?
Pardon?
What kind of doctor? I mean, an internist? What kind of
Do you
doctor?
have a primary care physician?
Yeah,
I would start there. And do you like your primary care physician?
yeah, but I'm not sure that this would be something you could help me with.
Then
I have some feeling.
you could ask him for recommendations, or you could, again, the internet, ask somebody to go on in your area and see who the specialists are that deal with this specific thing. As big a hospital as Yale is, they do not have a pain clinic. They have doctors that are in other departments and work with pain as well, but Yale does not have a pain clinic. They have a clinic for everything else, but no pain clinic. So Connecticut, it's not that easy to get.
And New York would be.
New York's got a lot of great doctors. I'm gonna see one in Albany for my migraines. I'm willing to bet,
Yeah, there's pain management.
Mount Sinai has.
Yeah,
They do. I want to say to this lady, I'm not suggesting, I forgot the name now. Go ahead, I'll get back to you.
any other questions?
Yeah, I got it now. This is a chair. I have 3 of these chairs. I inherited.
Can you speak up?
I have 3 Knowles chairs. I inherited 2 from my mother, and the other one I bought myself on a discount through a friend. They're expensive, but when I have a gathering with people, I have some friends who have back problems, and they said, "Are you going to have your Knowles chairs out?" And I said, "Yes." And you will have first.
So you get people to come to the party.
And they,
You-
and they sit in those chairs and they say, "Oh, this is so comfortable," because they are. You described something before about chairs. I mean, they have.
Contour,
They're
right way.
contour chairs, and they're really wonderful. And even though I'm sure they're still very expensive, suggested that maybe you could go down there and take a look at their chairs, and then see where you can find chairs that are similar to their chairs.
Knowles.
Knoll.
Yeah, when you say go down there, is there?
It's in Manhattan.
It is Manhattan, okay.
Okay.
I have a thought about the chair. Aaron Miller, Herman Miller Aaron chair.
Yeah.
I think some of the office supply places you can actually try them.
Yeah, I have them. I use them for kitchen chairs. I'm looking for something that is, I have them on wheels. You know, and at some point you want to stop wheeling around in the chair. You just want to kind of sit in the chair and read a book or
there are recliners that actually, they're electric, so if the power goes out, you're stuck in it, but that will actually lift you to a near standing position. So if you've got balance problems, muscle problems, back problems, it's a
Yeah.
good tool to have. But again, if you're in reclining and something happens, you're stuck. You had a question? Yeah.
Yes, I don't know if you qualify it as pain. It's actually an injury, sort of. You know, it's like this lady said it's a joint. My joint is, the cartilage is receded there. The bones are clicking. I don't hear them, thank goodness. I hear other clicks, but not that click, and I'm very happy about it. But I've been to all kinds of doctors, you know, and I've been to braces they put on there. They would get too tight and make things worse. They always say, like, we've got to do surgery. First thing they tell me, they didn't even know my name. Hello, we're gonna do surgery on your foot. So I say, thank you very much, but so long. So, but it is painful, you know, to walk around with the bones like saying hello to each other.
Right.
You know, and it's really not to my advantage. Go away. I mean,
Did
be
you
a little, you know, strange to each other, but they don't
Did you
want.
say you did physical therapy?
I don't do physical therapy. I should, I suppose, but I can't see how that would affect the thing.
What I was going to say is surgery may end up being the answer just because as the cartilage wears away,
Yeah, that's
then
what
there's no buffer. There are some, again, online. I saw a special on it on PBS or something, but you could go online. There are some orthopedic surgeons that are injecting, almost like making a new type of cartilage or
Yes,
whatever
I
in
know.
between there in
I
place
heard
of
of
the surgery.
I heard of it. I was injected by some of that material, and I don't know. It requires very pinpoint. That I understand pinpoint injection. You know,
Yeah.
right? If you don't put it in the right place, it causes bad
It
things.
sounds like that was a steroid injection. Is
I've
that what that
I've
was?
had-
had the hyaluronic acid is what you're talking about, and actually is the stuff that the
Right.
synovial fluid is made of.
That's the word, thank you.
And when you put it in,
Synovial
now,
fluid.
it replaces what's missing. And also, apparently, it can stimulate some cells that might not be dead to start
Mhm.
making it naturally again. And I have it, it has helped a great deal. And I'm on the second series now. I had it. My first series was about a year ago, and now I'm on my second series.
Of what?
And it does help, but it does help. It's not, it isn't, 100%, but it's a dramatic difference.
Well, I've had,
HYAL.
I've had the, injections, various, so I can't think of the name there. They're quite medicinal, and I can't remember them. But, so you suggest that I should go have the surgery?
Oh, no, I'm not suggesting that.
Most people say, that's the last resort.
Absolutely. But if you go to a doctor's office and the first thing they say without knowing anything else about you is we have to do surgery, it's probably not the doctor for you.
I haven't found a doctor for me. I don't know where he is in Siberia.
So you won't be able to serve.
Albany?
Cartilage issues and replacement cartilage is evolving really, really quickly. I mean, I had the injections about 8 years ago. It didn't do anything.
It didn't help me, so one of the
That's
injections did help me.
good, but the chemistry involved in how cartilage regenerates and what a framework that they can put in to make the cartilage grow and such, it's changing very, very quickly.
I know.
So-
So have you found a way to live with it? Have you got some sort of material that was in that they put in your foot that enabled you to?
Well, I had a cartilage transplant, which did not take.
Oh my goodness.
Or didn't take 100%, or, wasn't
Yeah.
totally. But that was several years ago, and I haven't done anything lately.
So that's where you have a lot of pain too.
It's not that old.
No.
It's not.
With all the work and studies being done now, they say, as you alluded to, there's so much being done that what was done one way 6 months ago may be done a different way in a couple months.
I hear every week some new, some new method to.
What I would recommend to you is find a doctor that you're really comfortable with, that takes the time to ask about you, that takes time to ask about your life, your lifestyle, other things that may affect you, whether it's pain, whether it's emotional. But you need a doctor that you can have a conversation with, not a doctor that just sits there and takes your stats. You need a doctor that will either sit down and talk to you or take the time to make sure that he asks the questions that you want to tell him the answers to, and you want him to listen to your questions.
I would just like to say something in relation to what you just said. I read an article which was choose a doctor who listens, okay?
Mhm.
Cousin of mine wrote a book. I think it was on television, and he wrote this book. The name of the book, I don't know if you can buy it, I can certainly find it.
Louder,
And
please.
the name of the book is The Silent World of Doctor and Patient. And it was, it was grabbed and he was interviewed on television for like 8 months on the book and she gave it to her husband and the husband was the interview.
Yeah.
Okay? But there have been articles in the paper about a doctor who listens to you. That's why
I always have to listen to the doctor.
What?
I always have to listen to the doctor.
The doctor has to listen to you too. In order to make a diagnosis, the doctor has to listen to you in many
You need a doctor that doesn't just listen, you need one that hears what it is you're saying.
Yes.
But there's a
Yes.
shortage of them. It's really hard to find them.
Sometimes the best places to find them are, there's a lot of good doctors in New York. Sometimes the best way to find them is to find one of the hospital clinics and get a referral for a specialist from them, because then they've got those tools at their fingertips. Oftentimes when you go to the clinic, depending on what type it is, they might have a little more time to spend with you to ask the questions. But the important thing is, if you don't get your questions answered, don't leave until you do. Take a list with you of what you want answered, and
Some doctors just don't because they're busy with the next patient.
You know, I think there's no substitute for your own thinking and analysis and judgment. And I think, basically, I think no matter what the specialist or the doctor is, whether they're a surgeon or an acupuncturist or a physical therapist or a neurologist, what does the expression say? To a hammer, every problem looks like a nail. They know their solutions. And it comes down to you to integrate all this and look at it in quiet moments and think what's best. And remember, it's not even cynical. It's just that, you know, when you go to a surgeon, they believe their surgery works. And a neurologist believes whatever they believe. But you have to step back and do the judgment, use the analysis. Never lie.
Another good resource for finding a doctor is, again, a therapist. Lots of times, because they can break down your life for you, what you need, what you're missing, and they get to know you for who you are. And they might be able to make the connection of the type of doctor you need, the type of bedside manner, no nonsense, somebody that coddles a little but gets the job done. You need somebody that understands you like you do.
I just asked that I think often a geriatrician is a good start.
Pardon me?
A geriatric specialist
Yes.
is a good start as well.
One of the things I wanted to also mention, you had talked about, you know, connections and having time for yourself, and also connections with other people. One of the things that we're looking at here as part of the televisiting program that Dr. Harrison Ross talked about earlier is the idea of being able to provide friendly televisits to people who might be living with pain at home. Sometimes just having that, you know, 20-minute break to get you outside of yourself can really, you know, take it from an afternoon of pain to maybe an afternoon that had a little break in it, and then you kind of feel good for a little while. So having, and a lot of people don't necessarily have that built-in support, or so if you can find sometimes some sort of a structured thing to get that extra social interaction.
I think that's the biggest thing for seniors is not having the support. You know, feeling like they're lost in the cracks. But I would like information on that, if you could get information to me about that.
Of course. We have flyers on the back table.
I just think that's a great idea, and that would be a great adjunct to support groups and whatnot.
And also the idea, like Dr. Harrison Ross just said, coming to Empowering Ethical Elders on the first and third Wednesday. Thursday. I'll delete that.
Yeah.
Coming to Ethical Elders on the first and third Thursday.
I just think, I know I was supposed to talk about pain and managing and coping with it, but the empowering is what I think why Paul asked when he knew he couldn't come, asked me to, because my whole life changed when I felt empowered. And I think that's the most important thing for anybody, any age. And it allows you to take the driver's seat.
You know, I wanted to say one of the things that the main doctor that takes care of my pain is a physiologist. And he knows that I went in saying, look, I want conservative management. I'm really not interested in any kind of vigorous therapy. And so he understood that, but I also, it was very important for me to tell him, this is what I want to do with my life. And, you know, for me, managing the pain is being able to do what I want to do with my life, really set my own goals. And I think, well, that's an important thing to really think about. You know, I'm still working at age 77 full time, and it's what I want to do. And I think that, you know, that's very important.
I think Frank, right? Alluded to the fact that how much Does it impact your life, the pain? And if it impacts it to a point where you're not living it, where you can't get done what makes you feel good. Sometimes that's the first thing to make sure you can do. Never mind the chores or anything else. Make sure that you are able to do the thing that makes you feel good. If it impacts you to that point, then that's when you need some type of assistance, whether it's exercise, medication, therapy, whatever.
Thank you.
Thank you.
I really do think you're such an empowered person. I'm not even sure if you're an elder because you're so.
I'm older than I look, but I'm technically not qualified for one,
Can you get discounts at Dunkin' Donuts?
only because I'm disabled.
Oh,
They give discounts?
No. No, but when we get the train tickets to come to New York, I get up there and I go, sorry, Cindy, I go, we'll take one senior and one disabled, so.
Oh.
Will everybody please help themselves